Hello, this is Amal. Our topic today will be swallowing. Some patients exhibit difficulty in chewing or swallowing, which may or may not be accompanied by the inability to feed themselves. Special techniques to compensate for such swallowing problems to promote safe oral intake and restore or maintain the patient nutrition and hydration requirements. The swallowing process. Anatomy of structures involved in chewing and swallowing. The swallowing process occurs in the upper part of the system. The bodily structures involved in chewing and swallowing begin with those that can easily be seen, such as lip, teeth, cheeks, tongue, and teeth. Other structures found in the oral cavity include the hard and soft palate on the roof of the mouth, the ovule at the back of the mouth, the lower jawbone, and salivary glands, which secrete saliva. Pharynx and esophagus are structures that lead from the mouth to the esophagus. The esophagus is about 10 inches. Strategy of flowing and swallowing. There are five phases of swallowing. Anticipatory phase. The following are key components of anticipatory phase involved preparation for eating, choosing the quantity of food, choosing the right food. During the anticipatory phase, the nurse should do the following. Inform the patient what food are being presented, position the patient properly, oral preparation phase. The following are key components of the oral preparation phase involves preparing the food bolus for swallowing, requires lateral vertical and rotary movement of the jaw for chewing, requires a good seal of the lips to keep food inside mouth and to prevent drooling, muscle strength to prevent food or liquid from falling prematurely to the throat, muscle strength and sensation in the tongue to move food around the oral cavity and form food into a bolus, requires saliva to help break down food substance. During the oral preparation phase, the nurse should do the following. Use a verbal cues to guide the patient, encourage the patient to take small bites of food, verbally cue or place napkin in the patient's hand and a cue to wipe his or her mouth. Verbally cue or place napkin in the patient's hand as a cue to wipe his or her mouth. Oral phase. Key components of oral phase last less than 2 seconds. Move the food bolus backward on tongue toward pharynx. Requires appropriate sensory stimulation and tongue movement to move the bolus backward. During the oral phase, the nurse should do the following. Use cueing to remind the patient to swallow, remind the patient to sweep the tongue to both sides to avoid pocketing food in the side of the mouth. Pharyngeal phase. The following are key components of the pharyngeal phase, last 1 second or less, involves the larynx moving up and forward, involves the epiglottis covering the top of the larynx, involves the tongue moving backward, pushing the bolus around the epiglottis. Ends with the structures returning to normal position. During the pharyngeal phase, the nurse should do the following. Observe the patient for signs and symptoms of choking or aspiration. Inform the speech therapist if the patient shows signs and symptoms of choking or aspiration. Suction the patient as necessary if choking is present. Esophageal phase. The following are key components of esophageal phase. Last 8 to 20 seconds involves peristaltic waves and gravity that push the bolus down the esophagus and into the stomach. During this esophageal phase, the nurse should do the following. Observe the patient to ensure that swallowing occurs and that the patient is not choking or aspiration. Report any unusual occurrences to the licensed nurse immediately. Be alert for excessive belching and complaints of pain or fullness in the mediastinal area. Now we can talk about causes of dysphagia. There are many causes of dysphagia. For example, a stroke or cerebrovascular accident, head injury, Alzheimer's disease, amyotrophic lateral sclerosis, MS, Parkinson's disease. Signs and symptoms of dysphagia. The patient may draw routinely or complain of a feeling that food is stuck in the throat during or after meal, or even while swallowing saliva. The patient may complain of discomfort in the throat or chest or sensation of lump, weight loss. Inadequate nutrition may also indicate a swallowing problem. Types of diet used in swallowing therapy. National Dysphagia Diet Level 1, theory, such as baby food. Food should be either be hot or cold. but not lukewarm. Hot and cold food increase sensory stimulation. Fruit should be pureed, not watery. Responsibilities for the nurse. Monitor food intake, provide small meals with the patient as indicated. Diet level 2. Mechanically altered. The food should be soft, moist, textured. Vegetables like green beans, carrot should be cooked soft to avoid dry, crunchy food. Responsibilities for the nurse. Monitor the amount of food, monitor the patient weight, monitor for choking and aspiration, provide oral care every 4 hours or more frequently if necessary. Diet level 3. The strategy advantage. Solid foods should be chopped to a fine to coarse texture. Breads can include toast, cracker, and soft dinner rolls. Responsibilities for the nurse. Offer options appropriate for the patient diet level. Report all problems to the speech therapist. Diet level 4. Regular diet. All regular foods are included. Responsibilities for the nurse. Report any deviation by the patient to the speech therapist. Observe for problems such as choking, coughing, drooling, and report them to the nurse. How to improve this result? Let therapist to instruct the nurse on the proper exercise for the patient. Lip strengthening exercise. Order to help the patient prevent spilling food or liquid from the front of the mouth. The nurse will remind the patient to stretch and hold his or her lips in the position like E and O for few seconds. Tongue exercise. Help the patient to use the tongue in both chewing, swallowing, improve range of motion or coordination. Tongue exercise include movements such as elevation of the tongue and holding it for 1 second, moving the tongue to each side and holding it, sticking the tongue out, and pushing against a resistance such as tongue depression. Jaw exercise. Open the mouth, move the jaw to each side, hold it for a brief period. Nurse will help the patient with only exercise. That can be easily monitored. The nurse must never initiate a new exercise for the patient. Help the patient with dysphagia as a nurse. For example, a patient has dysphagia in the oral phase may be helped by receiving verbal cues from the nurse using a mirror during meals by help the patient become more aware of drooling on the lips, chin, or mouth during eating. Cue the patient to wipe his or her mouth with the napkin or place the napkin in the patient's hand and help the patient to move the hand to the mouth. The nurse might be instructed to put external pressure on the cheek to remind the patient not to pick food in the cheek. The patient may need cueing to use the tongue to sweep sides of the mouth to help form the bolus before swallowing. If patients are unable to feed themselves, the nurse should place food on the tip of the spoon using half a teaspoon on food and present it to the center of the patient's lips. If one side of the lips is very weak, the food should be presented towards the stronger side. After the spoon is removed, the nurse may have to manually close the patient's lips and hold them closed if the patient cannot do this. When difficulty occurs in the pharyngeal phase of swallowing, the nurse can assist the patient by providing warm and cold foods as well as liquid with the viscosity as indicated in the care plan. Cueing the patient to tuck their chin or assisting them in tipping the head down before swallowing will help keep food or thick liquids from spilling into the airway before they are ready or able to swallow. Such as citrus fruit juices should be avoided to prevent heartburn. Alcohol, nicotine, coffee, fats, and chocolate can contribute to heartburn and should be avoided by patients experiencing difficulty with the esophageal phase of swallowing. The nurse should be aware of the patient's meal skills. The nurse should be also note the patient's level of fatigue. When a patient who is capable of independent feeding becomes overly tired, the nurse should help feed the patient. The nurse should be aware of the patient's social dining skills and attitude. Next, to enhance swallowing process. Patient in room when possible. Eliminate the structure, TV, radio. Sit patients sit straight up in the bed or chair. Place foot on right or left side of mouth. Press hand on right or left of mouth. Prevent pocketing of food. Tilt head to right or left or forward or back. Give bites of half teaspoon at time. Allow complete swallow before patient receives next bite. Alternate between liquids, solids, facilitate movement of food. Encourage patient to eat slowly, don't rush. Push spoon or cup down between bites, reduce speed of eating. Patients should not use straw. Nursing staff should administer any liquid medication by spoon or straw rather than patient drinking from cup. Also, we follow the checkpoints on the checklist done by the therapist and to make sure that the patient is following the recommended plan. The nurse will be able to review the patient's diet order and the plan of care. Correctly check the diet order, check the liquid level as ordered, ensure that the patient is positioned upright approximately 90 for eating and drinking. Correctly position the patient head midline, turn right, turn left. Check whether the patient is fully alert for eating and drinking. Offer the patient small bites of food. Remind the patient to eat slowly or feed the patient slowly. Make sure to alternate foods and liquids as recommended. Remind the patient to swallow with every bite or food or sip of liquid. Correctly check the patient's mouth and make sure that no food is pocketed before taking the next bite or sip. Remind the patient not to talk with food or liquid on his or her mouth. Remind the patient not to eat or drink with coughing. Correctly check that the head of the bed is elevated at least 30 to 45 or as specified in the plan of care to prevent aspiration after the patient is finished eating. Make sure the patient remains upright for at least 30 minutes after eating or drinking. Be alert to problems the patient may demonstrate, such as shortness of breath, gasping, coughing, and choking. Assist with or perform oral care. Thank you.